Hello and welcome to another episode of EllieMD's educational series. We're so excited to have you with us as we continue our mission to empower healthier, longer lives through education, innovation, and community-driven care. Today, we're honored to welcome back Dr. Josiah Wagner, a visionary in regenerative medicine, peptide therapy, and hormone optimization. His story began at just 16 years old following a severe back injury. Rather than settling for a life defined by chronic pain, he dove into the world of peptides, stem cells, and biohacking, sparking a lifelong commitment to helping others heal and thrive. Now, as director of clinicals at RX Reinvented, Dr. Wagner trains providers across the country on breakthrough therapies that merge modern medicine with science of longevity, including advanced strategies for weight loss, anti-aging, and total wellness. Dr. Wagner, welcome back. We love having you here. Welcome, welcome.
Hey, honey. Thank you for having me back. Excited to be here.
Well, for those of us who are tuning in for the very first time, can you share a little about your story, your journey, what brought you to this field? I know you've spoken before, but share with us.
Sure. I mean, my story is pretty boring. There's nothing really exciting
It's
about
not.
it. Um, yeah, I mean, I was just like a normal kid, 16-year-old, just living my life. And, I was a high-level competitive gymnast. And, when you're young, you pretty much feel invincible. You haven't really like gone through life. You haven't really gone through anything hard. And like she shared, I suffered a pretty severe debilitating back injury that left me in constant chronic pain, whether I was sitting, standing, walking, whatever I was doing. So that really like changed the course of my life. Um, it basically like took away my identity. Like I was no longer the gymnast. I was no longer this 16-year-old boy. I was this person who was just in chronic pain, and no one could really help me. The medical doctors couldn't help me. Chiropractors couldn't help me. PT couldn't help me. I basically became an enigma, and they're just like, everything's fine with you, and everything wasn't fine. So that led to like a 20-year journey of, having to become my own doctor and resolve those types of issues. And so like here I am today.
Oh, what an inspiring story. Thank you for sharing. I've
Yeah.
heard it many times, but every time I feel inspired
Mhm.
by your journey. Um, so let's get started. I was just recently on a cruise ship with a lot of little kids. I was on a Disney cruise. It was only a few days, but oh gosh, it was enough to do a lot of damage to both my
Sure.
gut lining, my overall gut health. And one of my friends thought it'd be a great idea to get me a pass to the spa, which had the steam room. And if you can only imagine the toxins in the steam room on a cruise ship. So lots of damage and toxin exposure. Can you share with our listeners and our viewers today how BPC helps with both gut health and repairing tissue and overall, I guess the oral BPC specifically? Can you share with us how that could help?
Um, yeah, so I guess, all right, so we're just going to jump right into BPC. So BPC, it's specifically synthesized from the gastric juice within your stomach. So your body naturally produces it. The problem is like as we age, our body produces less and less and less of these peptide compounds. So the healing process is slower. One thing within your gut, though, your gut is made of what's called is like tight junctions. And when your body gets inflamed, those junctions, they start to separate. And this causes what's also known as leaky gut, where when you eat some food, the food particles go through those junctions that are now loose, get into the bloodstream, and because they haven't been digested, it causes this chain reaction where it actually triggers the immune system. So it can start this chain reaction of this autoimmune case and lead into like a histamine response and all these other issues. So BPC 157 specifically, whether you do it injection based or oral based, because it is a small chain of amino acids, it can be oral or injectable. But what it does first is it's gonna tighten those junctions. So then we're gonna start to tighten those junctions. You're not gonna have that assault of that food going through. So first you have to remove the assault so you're not overactivating the immune system. Then the second thing is that there's like a layer. There's a mucosal layer that goes on top of those tight junctions that act as like a buffer. And that's where a lot of like the good bacteria actually colonizes. So now we have repopulated the environment so that your body can actually colonize good bacteria. Because if you don't deal with the tight junctions and help with the mucosal layer, you could take all the probiotics in the world and it's really not going to do anything because you haven't changed the environment.
Can you, I mean, we jump right into
Sure.
BPC, but maybe we take it
Mhm.
one step back and talk about peptides as a
Yeah,
general. So talk to us. You
sure.
said it's short chain amino acids. Explain to our listeners who are here for the very first time, what are amino acids? What are peptides? Just define some of these.
Mhm. So like amino acids are like the building blocks of life. And when we have smaller chains of them, they're known as peptides. When we have larger chains of them, they're known as proteins. And we know proteins are very important for building blocks of the body. When they are in these smaller chains of amino acids, such as the peptides, they act more as signaling molecules. So they really help to store homeostasis back within the body because we have multiple different like levels of peptides or gene expressions that can be enhanced by taking a peptide. So the way I like to express it is it's like giving your body a software update. You haven't updated the iOS on your iPhone in a long time for 30 plus years. You know, it gets old, crusty, not running as well. Taking these peptides, it's like recalibrating that iOS back to factory setting to where it's having that cell to cell communication without any interference.
Mm. Well, thank you. Thanks for the explanation. Now, going back to BPC, you mentioned that it helps with a mucosal lining and with the gut microbiome. Can you share with us why the gut health is so critical for overall health and wellness?
So I'm going to draw that out a little bit first. So I'm going to try this if you guys can see this. Okay, so
Wow, we got a whiteboard
you
now.
have your gut right here. So let's say you have your esophagus here, food goes in here. So this is like the first line of where your body has to break the food down. The problem is what happens is, again, we talked about the compromise in the tight junctions. We talked about the compromise in the mucosal lining. So what happens is not only do food particles start to get out into the bloodstream and it causes an activation in what's called as your Th1, Th2. This is a part of your immune system where we see histamine responses. But another thing happens. You got your brain up here, and you got something that's called as the vagus nerve, which travels directly from the gut to the brain. Now that this is all happening right here and your gut's inflamed, it's causing irritation on this vagus nerve, which is causing irritation in the nervous system right here. And the nervous system, through the spinal cord, feeds all your organs, whether it's your liver over here, whether it's your kidneys, whether it's your gallbladder, spleen, pancreas, all this is now inflamed. So different people are going to experience different systems because the body is so intertwined. And everyone's going to have a genetic weakness that's going to show up more. Some people could, it affects their eyes, you know, because the eyes are literally like an outgrowth of the brain. Some people could have more liver pain. Some people can have more pancreatic pain. So dealing with the gut is super, super important because there's a reason they call it your second brain. So gut health is very much related to brain health, which is related to full body health. So again, the interconnectedness of things, you can't really dissect things into layers and say like, it's only going to affect this or only going to affect that. That's the beautiful thing of peptides is that they don't just have one mechanism of action. They have a primary, a secondary, and a tertiary mode of action, and they're typically upregulating 500 plus genes expression. So that's where it's really tough when people are like, hey, what is good for this symptom or what peptide is good for this symptom? Like that's all good and everything. So like, you know, BPC is great for musculoskeletal issues as well as a whole host of layer of other things. But we want to treat the systems of the body. We want to improve overall health and wellness, because as we improve overall health and wellness, a lot of the symptoms start to naturally improve themselves. So like the main things that typically go on within the body too are inflammation. Inflammation is like that first domino that goes off in that chain reaction that starts everything else. Once we have this chronic inflammation, that could be, let's just talk about, since we're talking about peptides and like BPC and GLPs, let's talk about metabolic disease. Metabolic disease leads to major chronic inflammation. And then what happens next over that is, again, this Th1, Th2 immune system goes off. So this is where we run into, again, an hyper or hypo reaction of your immune system. So it's either acting too much or too little. And this starts to deplete resources from your body to where your body can't regulate itself. For example, you have a bad night of sleep, or work is stressful, or the kids are bothering you. Your body doesn't have the resources to self-regulate itself because it is dealing with so much turmoil inside. So when you can deal with that internal turmoil and calm that down, that helps you to deal better with your external world as well. Because what happens next is your energy systems are down-regulated, which is mitochondria. So again, you don't have the currency to even face life. This is where people run into like chronic fatigue, brain fog, overall sense of just like not well-being and not feeling well. And they're just like, I just don't feel like myself anymore. And people start commenting on them. It's like, yeah, you're right. You don't feel like yourself. And like, yeah, we could say like go to therapy or do this, but it's like really fixing the underlying issues with these three things right here could be 80% of the problem of what is causing you to feel unwell.
Gosh, and it all starts with the gut. Wow.
Yeah, all
And
starts with
and
the
you
gut.
forgot to mention that so many of our neurotransmitters are manufactured in the gut, like 92% of our serotonin, for example, and our
I
dopamine.
didn't forget. I just wanted you to say it.
Well, thanks. Um, so going back to BPC,
Yep.
you mentioned it helps with that lining, it
Yep.
reduces the inflammation. We
Yeah.
also, in our capsule, we have TB 500, right? Can
Yeah.
you touch
Yeah.
on how TB also assists BPC with gut repair?
Yeah. So there's a lot of overlap with both of these, and people get them both confused in how they work. So again, we have your gut right here, which BPC 157 is made in the gastric juice right here. And then TB 500 actually comes from up here. TB 500 is actually a fragment of a longer chain of peptides. So this is your thymus gland right here, which is just below your thyroid. So it's like right here in your chest, right here, your thymus gland. And it has to do a lot with training your immune system. So this is more of an immune system regulator. So this actually comes from what's called this TB4. And this guy right here is a fragment. So this guy's a longer chain, and this is like a fragment of that chain right there. What that is that actually works better because this fits in the receptors. And so this one can be, again, oral based, or it can be injection based. So a lot of the peptides straight up don't work that well orally or topically because they're still like pretty long chains. They have to really be like under 14, which some of these fall, like GHKCU, BPC, and TB500. Those are the ones that can be like oral. GHKCU can actually be topical. Now, the way that they overlap is, again, primary mode of action, musculoskeletal system. BPC is going to help more with the ligaments, tendons, joints, muscles. Also going to help with like the gut lining. TB is going to help regulate the immune system because, like we said, when those food particles are getting out from those tight junctions being loose, we have this over or underactive immune system. So we need something to target this as well as heal that. So now that we're doing this both simultaneously, this is where people get better faster because we're addressing two issues with one product. So we're helping balance the immune system with the TB500. And then the other part too, what I like about TB500 is does two other things that no other peptides really do. One, it helps break down scar tissue, and then it also does neogenesis. And neogenesis, all that means is it takes the cell and converts it to its original state before there was any quote unquote damage to that cell. So you're basically like restoring that cell again back to that factory setting without any defect to it. So it's improving structure and function. So when you do both, again, people respond a lot faster.
So, I mean, mental health is a really difficult subject to talk
Mhm.
about because it's so complex and it's multifaceted. But for someone who's going through depression or brain fog or anxiety of any sort, could that potentially be linked to the gut and perhaps leaky gut or the inflammation within the gut or something being off within the gut?
Yeah, I mean, just what we know again with the gut causing that neuroinflammation, as well as like the amount of neurotransmitters, serotonin that can be produced in the gut, you can definitely say it can lead to potential like mood. I'm just going to call it mood dysregulation because that's what depression is. It's again your body's inability to regulate itself. So I'd like to call it more like mood dysregulation. So again, when you help restore homeostasis to the body, when you give the body what it needs, it's able to handle the stress. It's able to handle the regulation. So again, yeah, I totally agree. I mean, it could be again one layer. Let's break. We got to break these things down into layers. You can't just talk. You just can't talk about it from like one coin. So like, for example, there's layers to dis-ease. You know, you don't just start with like insulin insensitivity. What happens is you start with, that insulin insensitivity. You start with pre-diabetes, type 2, and then type 3. Same thing like with depression. If we have depression right here, who knows where on that chain this actually manifested itself. So there's layers to helping with this. Could it be the gut and the neuroinflammation? So we want to just like peel back those layers until we see improvement. So maybe taking the BPC helps someone improve 10 or 15%. That 10 or 15% could have been all that they needed to maybe go see a counselor or to start eating healthy or to start picking up a gym habit. Then doing that, that's maybe another 10 or 15% of where they're starting to improve. And then once they improve that, maybe they make other life adjustments. So it's like nothing is just like a cure-all or an end of itself. Everything is just something along the journey as a tool to lead you to that next step.
Mhm, mhm. Oh, I love that. Well, I bring this up because after that cruise, I just felt off. Like I can't put my finger on it. I felt a little off, like the brain fog and a little bit of anxiety. And it really is linked to the food that you eat and the exposure
Mhm.
that you have as far as your environment and toxins. So
And even just traveling in and of itself, it
that's
throws you
true.
off of your routine. We're very much like your body is very much like a creature of habit. Your body gets hungry at the same time every day. It gets tired at the same time of night. Like our body lives off of these circadian rhythms that we can train. And when you travel, it throws everything off. And again, if you're not eating well, sleeping well, taking care of your body, you're not providing your body with the things that it needs to adjust within those changes. So yeah, you're gonna feel off.
And not to mention the hundreds of little kids running around,
That's
the
true. That's true.
exposure.
That's true.
Okay, so you start taking the BPC TB500 oral capsules. How
Uh,
soon should you start feeling better or reaping the benefits? Is it immediate? Is it like, does it
yeah,
take a couple weeks to kick in?
that's super super case specific. Like the epigenetic effects are happening right away, like instantaneously. But in terms of resolution of symptoms, that's where everyone is different. Same thing, like you don't set the same expectations when you start a gym routine. You don't go to the gym one day, 2 days, or 3 weeks and like, I'm going to look like Arnold after that time. That's not
No,
realistic.
that's not how
No,
it works.
unfortunately, I hate the Versher bubble. But again, this is where everyone's different. You know, some people might experience relief within 3 days, 4 days, a week. Some people it could take multiple weeks because depending on like where they're at, but it is working right away. For example, I had an ankle injury that turned into arthritis in the joint to where I couldn't walk on it. And so I started doing the injectables. And because it had degenerated so much, it took me a solid 6 months of like cycling through it to get it to be to where I couldn't walk without pain. So that was for me. So like, yeah, like I experienced some relief right away in terms of like pain, but overall like restoration, it was like a 6, 9 month process. So that's where it's individual, but know that it is working. Same thing again with going to the gym, even though you're not seeing the results right away, over time, when you look back, you can tell that you have come a long way.
Mm. I have someone that just wrote, so far, I'm loving my BPC tablets on an empty stomach for my knee pain after a year of breaking my knee in
Yeah.
surgery. The pain is non-existent right
Well,
away.
and the biggest thing about these things too, again, looking at peptides versus what are the other options that people have? NSAIDs, steroids. Like,
Mhm.
what are the other options? If you take an NSAID, yeah, it's going to help with that temporary inflammation, but it basically inhibits your body to produce prostaglandin, so you're actually tearing up your gut more. If you're taking a steroid, yeah, it's going to help with that immediate pain, but the cartilage starts to break down itself afterwards. So it's like, what other options do people have to where the side effect profile is so low? So again, maybe it's not working right away, but the side effect profile is way lower than anything else that you could be taking out there.
Okay, can we touch on a lot of peptides you can't take orally because they degrade going through the gastric
Okay,
juices and
sure.
so forth. That's
Mhm.
why you have to inject them, including the GLPs, and unless there's an absorption technology of some sort or
Yeah,
other.
I wonder if anyone has
How
that.
coming soon.
Yeah.
Can you touch on how and why BPC works so well when taken orally compared to other peptides?
Again, it's just based off the chain, the number of chains. So again, it has to fall under 14 chains. Otherwise, it's really hard for the body to really break it down to
Mhm.
feel any type of effect within the system. Some of them are just like too large and they don't really work that well in terms of like oral delivery. So, like BPC, I'm sorry, the GLPs, I know they've been manufacturing the drops, but it just doesn't work as well. It's too long of a chain, doesn't get it directly into the bloodstream. Same thing with like what's another, like a growth hormone one. Like you can take it and it's gonna do something, but it's just you're getting like 100% of it in the injectable base versus the oral base.
However, with the BPC, the studies, because I was just looking at some of the
Yeah,
studies
the
today.
BPC is really unique in that
Yeah,
you can do both.
right.
BPC can be oral, KPV can be oral, lorazepam can be oral. Um, again, TB can be oral, and then the GHKCU can be oral, or I'm sorry,
Topical.
topical or injectable. So,
I'm just gonna quickly touch. I know we touched on it, but if you could review it. Someone said, does the oral BPC TB 500 help with chronic pain or just gut health? Maybe you could just do a
so it can, if you have gut health issues, those can lead to chronic pain issues. Because again, if you have like a inflamed gut, your body is not absorbing the nutrients. If your body is not absorbing the nutrients, your body can't heal. So then that can lead to other pain issues.
Mhm.
So again, that's where each person is different, and you just gotta kind of like I just gotta say like try them both and see which one works for you. And because I could tell you what works for me and what I've seen work for patients, but every time I feel like I understand which one works for patients, sometimes they surprise me. Sometimes there's that wild card to where one works better over the other. Obviously the benefit of the capsule form is, you don't have to inject yourself and it's easy to travel with. But if I'm dealing with an acute or chronic injury specific like joint, I'm going to defer to the injectable over the capsule. But again, that doesn't mean that the capsule cannot help with like overall chronic pain. That's where it's like it's a trial and error type deal thing.
Oh, well, can you also touch on, these medications? Like, can we take them indefinitely? I know we need to cycle, and maybe you could touch on the cycling schedule.
Yeah.
However, like, if you're cycling this, is it
Yeah.
safe to use indefinitely? How long should you use them?
Yeah.
So much.
So, all right. So I'm just going to go over some rules in terms of like dosing and how long you should take these things. So you have your line here. So, and let's break that up in half. So this, let's call this like your micro dosing. Let's call this your macro dosing over here. Let's say this is like 200 micrograms. Let's say this is like 10 grams. This is like 2 grams. So this line represents a lot of different things right here. And I'm just going to like try to keep it pretty simple. But in terms of you're taking about how long you can take it. So if I am over here on this micro, not only does this represent the amount of dose, but this also represents the amount of time that I can take this. So if I'm on a low microdose, I can take it for a longer period of time. If I'm on a higher macro dose, then I want to shorten that period before I take a break. And typically a good break period is anywhere from 4 to 6 weeks. So I just kind of keep it 4 to 6 weeks before I try it again. And you can flux on this line a lot. Like maybe you have something going on, whether it's like, like your gut is like really feeling it, or you're having like a severe injury. Maybe you could front load a higher dose and then drop down to a micro dose for a longer period of time. So there's a lot of different
Is
ways that
that?
we can skin
Can,
this.
can
What?
you share why is that? Like, why is it a safety issue? Is it
It's
just
not a
giving the time
safety
a
issue.
break
It's
to
a
not
it's a
get
it's a
used to
it's
it?
a chemical signaling issue. So when you take a higher dose, you're producing a higher chemical signaling. And when you're taking a lower dose, you're producing a lower chemical signaling threshold. So you're allowing the body to adjust to that lower chemical signaling. So it's not like a safety issue, but you want to run it in a way and take a break so you can allow the body to recalibrate, because again, each of these things are going to throw your body in different directions, and we just don't want to create any imbalances. So like the only thing really with BPC 157 is people who are like really high dopamine dominant, they want to take more consistent breaks with that.
Okay. Can you touch on some other peptides that BPC can synergistically work with? I mean, we have TB 500 included, but what else can you combine with BPC for? Let's start with gut health. That since we're on the subject and it's so important, let's talk about gut health and
Yeah.
then
So in terms of like if you want to stack like a healing stack peptides, where we're increasing stem cell production as well as stem cell migration, we're increasing wound healing, we're increasing antioxidant production, we're decreasing reactive oxygen species. What I would pair, I would do BPC 157, the TB 500 stack, plus the GHKCU. Because GHKCU, the biggest thing, even though people use it for, skin health, hair, the biggest thing that what it helps with that is stem cell migration. So it's increasing not only the amount of stem cells, but the circulation of the stem cells. So that's like my favorite one in terms of like overall healing. Now, if we want to stack it another way in terms of, you know, building and recovery or performance, that's where I'm going to stack it with a growth hormone secretagogue, such as like Samoralin, because this is how BPC works. So let's say you have your growth hormone peptide, you have your BPC CB500. So this growth hormone peptide, so growth hormone, it's the master hormone. It helps with so many things within the body, lean muscle mass, sleep, inflammation, the list goes on and on and on. So the limiting factor is you got all this growth hormone in the body where it's working, but you need the receptors for it to connect to. And typically people who have gut issues, systemic inflammation, overweight, chronic disease, you have a downregulation in those receptors. So you're only getting like a certain amount of it. BPC 157 comes in here, and this guy actually upregulates the growth hormone receptors. So it's like you have a parking lot and it's full. There's nowhere for this growth hormone to go. BPC makes a whole new empty parking lot for your body to be able to uptake it because it upregulates those growth hormone receptors. So you like, it's amplification. Really stacking these things is all about how can I amplify this to get more bang for my buck out of it. So those are two that I love to mix with like the BPC 157.
Well, thank you. So we have a lot of people in our community that are using GLP-1s, and they're focused on visible results, but let's talk about long-term wellness. Let's talk about some of the peptides that can enhance and protect the body during weight loss. How do peptides like Samoralin, which you touched on briefly, and NAD complement GLP-1s in improving metabolic health and
Yep.
cellular energy?
Yeah. So in terms of that, so GLP-1 is the biggest thing that is going to help, whether you're taking a GLP or a GIP. Biggest thing is we're increasing satiety. By increasing satiety, we're decreasing your overall or total count of calories, which is leading to the weight loss. But when we decrease the total amount of calories, a couple things start to happen. Not only are we increasing weight loss, but there's two types of weight that we're losing. We're losing a little bit of muscle, losing a little bit of fat, because muscle is very expensive in terms of calories. So this is where it can lead to like sarcopenia and potentially like osteoporosis because you're not building at that point. This is where adding Samoralin can help because we're going to help your body hang on to that lean muscle and increase fat loss because again, Samoralin is going to help with that growth hormone production, which helps with lean muscle mass. So we can help your body hang on to more lean muscle mass while you're in this low calorie state. Now, in terms of NAD, again, when you're in a low calorie state, sometimes you can feel like a little bit more lethargic, have a little bit more brain fog, especially in the beginning. But by taking NAD, that can increase mental acuity and energy within the body. So you start to feel good. And that's the biggest thing to staying with something is if you can feel good faster, you're going to be more likely to stick with something long term.
I just asked if you're using Samoralin, do you need to do weight training or muscle building exercises to really reap its benefits?
I mean, same thing if you do anything. I mean, anything that you can stack with something, you're going to reap more benefits. So yes, Samoralin is going to be more anabolic. So if you are adding in some weight training, yes, again, you're sending a higher signal for that muscle building. So yeah, you will reap more benefits of something like that if you do stack in these healthy habits.
Okay, let's shift gears and talk about glutathione.
Okay.
Maybe you could first talk about what glutathione is, how it works, and then we could talk about how it works well with GLP-1s.
Yeah, so if we look at the liver, where all your blood circulates through, it basically filters all your blood every 3 to 5 minutes. And what it's doing in the blood, it's doing a process that's called phase 1, phase 2 detox. Because what it's doing is it's taking these fat soluble toxins in the blood and then it's converting them in the liver to water soluble toxins so that can be excreted by the kidneys, filtered by the kidneys, and then excreted by the gallbladder. Otherwise, if your body doesn't go through this phase 1, phase 2 detox, those fat soluble toxins will circulate through your blood and then they get stored in adipose tissue. So your body starts to store those. The way that this conversion happens, though, is with glutathione. So glutathione is one of the body's master antioxidants, sulfur-bearing amino acid that helps with this conversion from phase 1 to phase 2 so that your body is properly excreting the toxins that could be potentially in your blood. Now, again, when someone is on a GLP, your body's breaking down the adipose tissue where your body could have stored toxins. So now there's more toxins circulating in the blood. So by adding an extra boost of glutathione, we're helping just take that load off the body even faster.
That's awesome. And how about insulin sensitivity? Can you, and like what results can you see if you're using glutathione? How
In
can it
terms of
help with
insulin
insulin?
sensitivity,
Yeah.
I've never honestly had that question before. uh, Man, I mean, I could theorize how it would work because I mean, if the blood is cleaner, things are just going to be working better. But insulin sensitivity has to deal more with the pancreas and just the overall muscle signaling that's happening within the body. So I guess if the blood is cleaner, which the blood then feeds oxygen and nutrients to the muscles are working better, which the insulin receptors are going to respond better. So then that would lead to indirectly improved insulin sensitivity levels. Yeah, I guess I had to think through that. I've never really thought through that before.
It was on my question list, so
Yeah.
I'd ask. Uh, so let's talk about what role regenerative peptides like BPC, TB500 play in mitigating potential side effects of GLPs, such as muscle loss or joint discomfort. We did touch on that, but maybe we can
Yeah, I
elaborate
mean,
a little bit more.
I hate the word like side effects.
Mm.
It's really not side effects. Your body's just going through like a recalibration process. Same thing when you again go to the gym, you feel worse in the beginning. You feel more sore. You feel more tired. You're like, what the F? Like this is supposed to give me more energy. This is supposed to make me feel better. It's supposed to see results. So when you start the GLPs, it's always go low and slow. Like don't try to, be a hero and lose all the weight that you want to lose within that 4 week period. Like that's like too much too fast on the body. There's so many, again, internal processes that the body's doing. It's breaking down fat, it's having to detoxify the system, the kidneys could be overburdened, the liver could be over. So like take these processes slow, especially in the beginning, and start to slowly build up momentum. I mean, the biggest thing that BPC is going to help with is any type of other underlying inflammation within the joints that your body could have. It's not really going to help with like the muscle wasting. That's where like your Samoralin is going to help in terms of like helping your body hold onto muscle. But the BPC is going to help if you are working out, to recover faster. So your body's going to bounce back more. So you might be able to add in an extra day of working out alongside that.
So we have a lot of women who are either perimenopausal, menopausal. How do these peptides, what role do they play during these phases in a woman's journey, health journey?
I'm not a woman, so I don't really know.
You could
No, I'm just kidding. I'm just kidding. I'm just joking. So again, these things are super, super layered. So to say it's coming from one thing or another is tough because it's like, where in the chain did that start? Did it start with the insulin insensitivity? Did it start with the gut dysbiosis or the leaky gut? Did it start with the chronic inflammation? Did it start with the immune system dysregulation? Is her body overstressed where she's not producing enough of the master hormones, such as like growth hormones? So that's where these things are so layered in, and it's so hard to give like a black and white answer because you really want to address all these systems systematically. So first we improve the insulin sensitivity levels with the GLPs. Then we can improve the gut health levels with the BPC and the 157. And then we can improve lean muscle mass, so restore insulin sensitivity within the muscle with the growth hormone peptides. And alongside, we don't know where in the chain, like there's that final straw that breaks the camel's back that restores that person's levels of, symptoms or gets rid of that disease. Maybe someone, again, it brings them 10%, 20%, 30%, 40%. And then some people, they might have to do like some type of like hormone replacement issue. But, when you are fine tuning the system like that, you're going to need a lot less, and your body is actually prepped to respond better to those things.
Right along that topic, Monet and Trent Paulson, they wrote, so do you have to stack multiple peptides? Will GLPs, GIPs alone not be sufficient enough for the body?
I mean, you don't have to, and I recommend starting, with just like one or two peptides in and of itself. But really, again, it just depends on like how fast you want to get well and like where you're at. Because if you do take a couple of these together, you just progress through it a lot faster. It's just like baking a cake. Like, do you just use flour, call it a cake, or do you use flour, water, sugar, milk? There's so many other things that go into that finished product. And again, the body is so layered. There's so many things going on. So if we can create your perfect cake program for you to where all those things are layered together, we're going to be able to get the end result. And everyone's cake is different. I like chocolate. Some people like vanilla. Like,
Mm. I'm just reading through the questions that are posted. Will Samoralin raise blood sugar if you're using GLP-1s, or will it lower it?
yeah, that's a great question. Actually, that's a really good question because if you're on, okay, we'll talk about the difference here. So Morlin is helping with your body's natural production of growth hormone, which is it's going to lead to a balanced blood sugar within your body. Now, if you're taking synthetic growth hormone, that's where we can lead to insulin sensitivity because there's no way for your body to regulate it because you're forcing it to be at a certain like level constantly. So growth hormone works on something that's called as a pulsatile system, meaning levels go up and down throughout the day. So if you're taking some Samoralin, it's going to help with that regulation of those up and down levels throughout the day. So you'll be more stable. But if you take pure growth hormone, it shoots it up and it keeps it up. So there's no peaks and valleys in there. So there's no way for your body to be able to adjust. The biggest thing that we want to do when we're thinking about these things is the body's ability to adjust, go up, go down. Same thing with driving a car. You need to be able to shift to first, second, third, fourth, fifth. You don't stay in overdrive. Some people do. Some people are so cortisol junkies that they love to stay revving that like fifth gear. They don't know how to shift. So it's all about shifting.
Mm. Talking about growth hormone, I mean, we have men on this call, we have women on this call. How does it differ between men and women? How does growth hormone differ and change and shift and adjust? You know, and how does Samoralin, a drug, a medication like a peptide like
How
Samoralin,
does it
men
change?
versus women?
Mhm. Well, the nice thing about these is these peptides are not gender specific. They work with the intelligence of the body. So whether you're a male, a female, whether you're 60, 80, 90, or 20, 30, 40, it knows what your body's needs. So as long as we're taking, a growth hormone secretagogue that's helping your body's natural production, again, it doesn't shoot it into overdrive to where it's like more stimulatory. So me and you, we could be on the same growth hormone peptide and it's going to work. It's going to meet you where you're at and it's going to meet me where I'm at. So completely different, which is
Right, did you hear
nice.
that? Did you catch that? It meets you where you're at.
Yeah.
So, and if it doesn't need it, it doesn't use it, it doesn't necessarily have
Well,
any.
most people are going to need it. Like your body needs growth hormone, and we know definitively that growth hormone production decreases as we age. And especially like throwing in, the very synthetic world that we're in that puts all these other stressors, it's decreasing at a severe rate. So your body's going to use it.
Now, is that true of NAD? Uh, that if you no, it doesn't work the same way. Well, I'm trying to segue into the next,
No.
which is Donna wrote, I'm on my sixth shot, started at
Mhm,
0.25 milligrams of semaglutide,
mhm,
and increased on my fifth shot to the next dose. I'm not
mhm.
having any side effects, but I'm losing weight slowly. Should I increase?
No, stay right there. If you're still losing weight at that dose, just stay right there.
Yeah, I like that.
No, you want to find that sweet spot.
And ride that for as long as possible, guys. The
Exactly,
goal is
exactly.
not to increase your dose. The goal is to find your sweet spot, and everyone's sweet spot is different, right? Like
Exactly.
mine could be a 0.5, and a lot of people have lost weight on the minimal dose for a long
Yep.
time.
Mhm.
And some people know they have to go to the maximum. So now, actually, let's talk about that. If you're not losing weight,
Mhm.
and you've increased your dose, what
Yep.
would you do?
Again, that's such a layered that's such a layered
That's why
question.
I'm asking.
There's
Yeah.
so many different ways all right, so couple different things that we can do. All right. First thing is if you're not losing weight, we got to ask the question why, and we need to look at some backtrack reasons. One reason why, or one step. So this is how we want to go through like an order operation. So you want to create your checklist, like 1, 2, 3, 4. So let's say top of the checklist. All right, why are they not losing weight? Inflammation. All right. What's number two? Maybe hormones. And then 3 and 4. So you want to make a checklist of what's going in order of operation. So first one here, inflammation can actually inhibits the body's ability to lose weight. So it inhibits the body's ability to break those bonds within those fat cells to release it to actually start to break it down. This is where TV500 can help indirectly with weight loss because that TV500 is going to decrease that systemic inflammation. And when you decrease that inflammation, the body is like, oh, it's safe. I can start to lose that weight.
Mhm.
The other way, again, is, maybe it's hormones. So this is where we use a growth hormone secretagogue, such as like Samoralin. So by using Samoralin, we increase growth hormone. The body's like, yes, I have enough resources. I have enough of this master hormone that I can manufacture this, and this. I can, put on more lean muscle mass. I can get into that deep sleep to where my body's restored. And then because of that, the body's like, okay, I can start to lose the weight right there. So there's that. And again, there's so many different layers, but you want to start to like troubleshoot some of these things. And the main thing is what I'm trying to say is I don't want the person's default setting to be that I'm broken or that this doesn't work for me. Because that seems to be our default setting is we're always so critical on ourselves. If something doesn't work, compared to the next person next to you. Why is Susan losing all that weight? Like, and I'm not losing anything. So the biggest thing is just don't go to that default setting to where you're like, I'm broken. This is not working. There's things that we can trial you through. And again, each one is going to bring you a level of success. So whether it's using the growth hormone, whether it's using the TB, whether it's using glutathione, because maybe your body's just having a poor time methylating. It could be a poor methylator. So that could help with that. Maybe your body just lacks overall energy. So then we can add NAD. So there's so many different things that we can add to this. And again, the nice thing about like trial and erroring of these things is each time you're doing this, you're taking a chip away out of it. So it's hard to say like which one actually did it, but by cycling through these, you're improving the overall system and function. So you're eventually going to get to your end time goal. And again, the side effect profile with these things are so little that you're going to experience so many other benefits by taking these things and not just the weight loss.
I know this is a talk about peptides, but I have lost significant amount of weight. I've lost up to 100 pounds, and I think we neglect nutrition, and we haven't really touched on nutrition. In my experience, it's sometimes I've had to increase my protein intake, and
Yeah,
that has
exactly.
been
Mhm.
uh, that has solved a lot of the problems.
Or you have to just eat in general and
You
drink
have to
water.
eat.
Hmm.
But can you touch on that? Because I think, you're very good about your nutritional intake and protein. Can you touch on the importance of protein and why we need it while we're losing weight? It's so, so, so important. We got to talk about that.
Well, we got to we got to take a 50-foot view of what we're doing, of what's happening. So again, when you're on the GLP and you're low calorie, every calorie counts. We don't want to eat empty calories or calories void of dense nutrients and building blocks for your body. And one of the best nutrient dense foods that you can eat is protein. It's the building blocks that your body needs to help maintain that muscle as well as like your whole structure and frame. And when you eat that too, you're not going to eat as many calories, but you're getting more like bang for your buck in terms of like the density of what it's able to do for overall healing.
Mhm. So I have Tiffany just wrote, how do we get the right plan? I've lost to 88 pounds and I've been stuck for about 3 months. I just added NAD and I do feel the energy. I've increased my protein, tracking calories, walking. Um, she's walking and she's doing
Mm-hmm.
weights daily. So, and she's not losing weight. What does she do then? And she's lost 88 pounds, right? But she's been stuck. It's a plateau. What do we?
That's hard to say because it's like, is she just going by the scale or does she actually have like an in-body scan to where she's actually seeing the amount of fat versus muscle that your body actually has? Because if we're just going by the scale, we don't really know what's going on because she could be at this sweet spot where she's losing the same amount of weight as just as much as she's putting on muscle. So if she's looking at the scale, there's no movement. So
Mhm.
that's where if you do like an in-body scan and you see the ratio of fat to muscle, those ratios could start changing. So that's where the scale can really be misleading a lot of times with that.
Exactly. It's very deceptive. So be careful when you're going just by the scale.
Mm-hmm.
Um, is it true that you should eat your weight in protein or just drink your water and weight? Oh, I struggle with this one.
So rule of thumb is like drink half your body weight in ounces of water. And they say yes, the it's just the reason they say that is for a couple of things. Is one, it's easy to calculate. So you want to look at lean body weight. Lean body weight is the amount that you want to eat in terms of protein, like 1 for 1 of lean body weight, not total body weight. So lean body weight. And again, what that is that's going to be more anabolic and it's going to support your overall like muscle recovery and weight loss journey because you're flipping more of your calories to good calories instead of like a lot of junk calories, like the carbs and the processed food. It's going to fill you up a lot more in terms of like overall satiety by doing the protein. So again, everyone is different. Some people have more compromised gut issues to where a 1 for 1 is too much. So again, start slow and increase from there. Start with a quarter of your body weight for a couple months and work your way up to there, and then increase to half, and then increase to 3/4, and then increase from there. Think of it this way. Put it in this perspective. All right, someone tells me to eat my body weight in protein. All right, that sounds good. All right, think about it this way. Go run a marathon tomorrow. That sounds stupid, especially if I've never run before. Like my body can't take that. If you're eating low protein for such a long time and now they're saying like eat your body weight in protein, that's stupid because your body's not used to processing that. So start slow and work up from there.
All right. I'm going to take one last question and before we wrap up, I know
Yeah.
it's been great and awesome, but we'll have you back. Is it safe for an 87-year-old with constant aches in the hip area due to arthritis to use BPC TB 500 if they don't have any other health issues?
Oh yeah, 100%. Yeah. Short answer, yeah.
All right, awesome. So, Dr. Wagner, any final words, any last words of advice, anything else you could share with our community
Hmm.
before we wrap up tonight?
No, I think I've said more than what people want to hear. So
Oh,
I think we're good.
well, we appreciate you so much.
Mm.
Thank you for being here. And I love the new addition, the whiteboard.
No,
Thank you
thank
for
you.
that. I love the visual.
Whiteboard, I got
Uh,
good lighting. It's
I
all it's all
know
it's all better.
we're improving.
Yeah, slowly.
Yeah, and thank you all for tuning in tonight. Thank you again, Dr. Wagner. Thank you all for
Yeah,
being part of this community. This is how we empower ourselves. We have to have the knowledge, the education. So thank you for being here to educate us, and we'll hope to see you very soon.
awesome. Thank you.
Thank you all. Have a wonderful, wonderful night. Take care.